Parul, Parul.
Okay, we are live now.
Yeah,
So,
that's great.
yeah. Super. Mm.
That's why it gets difficult for me to remember their names now because I can't associate their name with their face when they meet offline because they just don't switch on. Half of the time we are just reading the name here. Come on, switch on phones, cameras.
Ma'am, it's wonder. Samaya is saying hi.
Hi,
Oh, hi,
Samaya.
Samaya.
See, that
Ma'am,
encourages you to, be like,
Tell
wow,
everyone to switch on the
Samaya.
videos, Samaya. Come on. You tell them they listen.
Yeah.
hi.
Yeah, Nikhil's phone is switched on. I don't know. The baby is
Oh,
there.
hi,
But
Nick. Oh.
hi, hi, Junior Nikhil or Nikhil. Hannah, we don't know what is your name, baby. Mama, tell us the baby's name.
Wait, sit here.
See, they have no hits coming on camera. They just, yeah, we are waiting for Parul to join us and to respond. And we begin as soon as Parul joins. Thank you everyone for joining our meeting. Yay, Mosami. Hi. Oh, great. Good update from Delhi.
Good evening, madam.
Hi, good evening, Mosami. You are
This is
Mosami, and that's
my daughter Rashi.
hi, Rashi. Hi, there's a
Hello.
Joy from Mrs. Joy's screen. Oh, hi, iPhone. I'm sorry, I don't know
Hello,
your
ma'am.
name. Hi,
Pooja.
Pooja. I'll rename you. So good, so
Shivansh,
good.
say hello.
Yeah, hi, Shivansh.
Bolo hello, madam. Hello, madam.
Oh, lovely. So
हाँ,
cute.
मैं
See, so easily they want, Anna. Okay.
Yes, madam.
Oh, another face has come. Hi, Sunita. Thank you for switching on. Hi, baby. So I think Parul is on her way or what?
Sammy, I think you'll have to start. It's
We'll
already
start.
5:09.
Yeah. We
Start?
are running against the time.
Yeah.
So yes, we will of course ask Parul to add her bit once she joins.
Yes.
Uh,
Thank you.
so namaskar everyone. मैं पारुल की दोस्त Sammy and we are here today again and welcome to today's session. And as parents of person with Down syndrome, we slowly come to an understanding of that some anatomical variations or structural variation of, like a high arch palate or reduced oral cavity or low muscle tone, which impair articulation, fluency, and resonance are, and these are so common in people with Down syndrome, person with Down syndrome, resulting in speech difficulties. Why I am so confident in using all these terms because we know our parents, they are very quick in learning and they all have understood these all terms or they will come in understanding because we are having such great experts in our sessions nowadays that you will all come to these are easy to understand for all of us. So and all that makes the role of a language and speech pathologist a very essential aspect in nurturing and caring of persons with Down syndrome. And speech and language therapy enhances, strengthens, is as a part of early intervention and cultivates a person's ability to communicate verbally and in writing. In addition to addressing any challenge the person may have with eating, drinking, or swallowing, speech and language therapy also helps. And we always have a very strong backup of having the good speech and audio pathologist with us. So in that sequence today, we are excited to have with us a very dynamic Ms. Yogeshwari Parthiban. She has completed her BA SLP and MSc Psychology, and she specializes in pediatric audiology and is practicing speech language pathology. The main aim of speech, okay, somebody wants to talk in
Hema
between.
ma'am, you are
Yeah.
unmuted.
Yeah.
Sorry.
Hi, Hema ma'am. Nice to hear your voice.
Hi.
So the main aim of speech and language therapy for our children, or the children with Down syndrome, is to maximize the individual's communication to their highest potential across their home, educational, and social environment. And speech and language therapy is a key intervention for children with Down syndrome. The earlier a child receive it, the better the outcome will be. And for the child leading a more independent life, and we know as human beings that's the only skill and virtue which adds more value to our lives, because we are able to communicate what we feel, what we want, and what we see, or our opinions. So our expert for today is experienced in treating and diagnosing speech language communication and swallowing challenges among various age ranges, and she's been practicing from over 8 years, provided counseling and assistance to individuals with diverse needs in various settings to enhance communication abilities among children, working with people with Down syndrome and a variety of developmental conditions, as well as swallowing treatments, are also of her professional interest. So, such a committed person whose interests revolve around her work, revolve around what she, can add to, give back to the society. And she's very committed and provides evidence-based, client-centered treatment to enhance communication and quality of life. We are very, very happy to have you among us, Yogeshwari ma'am, and we are also happy to say that she is a part of our Mathur Mandir, and she's been empowering parents and children there. Thank you so much, Yogeshwari ma'am, for joining us in short notice, and we are very excited, and we are all ready to hear from you and learn from your experience. Over to you, ma'am.
Thank you, Sami ma'am. Like such a warm welcome from you all. Thank you. So you all here. So just again, in terms of introduction about myself, I'm Yogeshwari Parthiban. Like most of you would have seen me in Mathur Mandir. Like I'm working there for almost 3 to 4 years. Like it's such a familiar, not a like a good familiar face, but a little bit of familiar face for early intervened children's. I'm mostly working there for working as an early intervention therapist over there actually. So over to the session now. Let's start to share the presentation.
Yes, ma'am. We are waiting for it. Yeah. So parents, keep your question answers ready. We will be switching to question answers round as soon as Yogeshwari ma'am finishes her talk. Yes, ma'am. We can go to presentation mode. Yeah.
Yeah. Okay. Thank you. So as you all know, like you would have heard about the speech therapy thing everywhere. Like so many of you would have heard here and there, like if the child is not speaking, just go to speech therapist. You would have heard these kind of terms everywhere, but you all don't know who is a speech therapist, what qualifications they hold, from where they are getting graduated, what is the license they have, everything. Are they a professional? Like are they are like fit to practice into these children with the Down syndrome and any other disorders? You need to know whether they are the professional first. So you need to, whenever you're going to a speech therapist, like whenever you're getting introduced to a speech therapist, you should ask for a license first. Okay, this is the thing you should first ask, like whether you are a licensed speech therapist or not. Like a speech therapist is a person who will get license from the Rehabilitation Council of India. they'll get a license from the Rehabilitation Council of India. They'll be having a certified license number. Here I have it, RCA number, here I have it there. So this is the RCA number. We will be getting, every professional will get over this number. If they hold this number, they are a professional to practice into this forum. Okay. So today we'll see about all the disorders about the hearing and speech language things and all. So how our Down syndrome children can communicate with the persons to tips to improve everything. We will discuss about everything today. So this is the glimpse of contents which we'll be seeing today. The first thing about audiologist. So first we'll see about the hearing thing and all. So then I'll go into these things. First, hearing is like, I feel hearing is much important for us to communicate first. So first we'll focus on the hearing. So who is an audiologist first? Yeah, like it's kind of a dual degree we'll be practicing. So it's a Bachelor of Audiology and Speech Language Pathology. So first, the audiology thing. Audiology is totally related to the hearing and everything. Okay, we'll be doing a hearing evaluations. We'll be doing fitting out the hearing aids, and we'll be doing all sort of hearing thing and all. So coming to the like why it is important to the Down syndrome childrens. So audiology, why audiologist role is important to the Down syndrome childrens, because like at the time of the birth itself, at the 24 hours of birth, we'll be doing an autoacoustic emission hearing test. It's a kind of a hearing test. We'll be doing it for all the children, not only for the Down syndrome children. We'll be doing it for every normal children to assess whether the child is hearing properly or not. Okay, so if the child is hearing properly, means that means the child is getting the feedback over everything, so that it will be easy for them to communicate in the normal environmental situations. So if the child is not hearing there itself, it's the 24 hours. If the child is not hearing, we'll be doing it in a 3 screening way pattern. I will be doing it in 48 hours. We'll be doing after 3 days. We'll be doing it after 10 days and 30 days. We'll be doing it in a 3 to 4 screening patterns. So if the child is if the child passes over those 3 to 4 screening, we'll be discharging the child. If the child is not hearing more than 5 screenings, we'll be putting the child into a detailed hearing evaluations and all, like kind of a BERA, more acute, more advanced hearing tests and all, we'll be recommending the child to go through. So if the child is not passing even all through that hearing tests and all, it means the child is not hearing properly. The child is going into the sensory neural hearing loss. There are a lot of types of hearing losses there. So we need to evaluate what kind of hearing loss the child has, what is the problem the child has, particularly anatomically or any other issues with the child hearing. We need to assess all that. And then we need to focus on the intervention part. So intervention part comes in when the child is not hearing properly. Now we need to put the child into the hearing aid first. We need to assess what sort of hearing, what is the amount of hearing the child holds, what would be the hearing aid which fits the child. So these are all the part will the audiologist only do. With the help of the ENT doctors, we'll be assisting with the ENT doctors, and we'll be doing it. So we'll be we'll be fitting the hearing aids. Nowadays, you would have heard about the cochlear implants and all. So a lot of people are making the child to go into the cochlear implants. Totally, if the child is not having 90% of the hearing has lost, means the child may go into the cochlear implant. Cochlear implant is kind of a device. Will be it's kind of a hearing aid itself, so we can hear it. We need to do some surgical things to implant the electrodes into the skulls and brainstem, so that the person can hear properly. So we have to program the electrodes and all those things and all audiologists do. So this is the main professional thing about the audiologist here. So what is the role of audiologist with the Down syndrome here? Particularly, we need to know more thing about the Down syndrome children, so that we can properly assess the child, and when we can intervene at the right time. So there are a lot of anatomical differences between the normal child and the Down syndrome child. So they have the seeing physically means they have a low set of ears. They have the narrow ear canals inside the ear. they'll be having the horizontal eustachian tube properly. They don't have a normal eustachian tube will not be there. So they have a large adenoids, they have a small nasal cavity. So all these anatomical differences will lead to the onset of a frequent onset of a URT infections, upper respiratory throat infection. So these upper respiratory throat infections will lead to the accumulation of fluid into the eustachian tube. So you will be having the eustachian tube here. It will connect to the inner ear and the nose. So if the fluid is getting accumulated over these ear canal, we'll get a fluid accumulation, and the fluid will start to ooze out to the outer ear. So this is the first sign. Well, the Down syndrome children mostly will have these kinds of a hearing thing. So if the child is often getting ear discharge, means definitely you should note, you should have to visit the ENT doctor, and you have to get the audiological evaluation right at the same time. Okay, so if again, there will be a lot of nasal congestions will be there, a lot of earwax accumulation. They'll be having a frequent sinuses and URT infection. They'll be having. So these all will lead to the conductive hearing loss. Conductive hearing loss is kind of a it's kind of a one type of hearing loss. We have some sensory neural hearing loss, mixed hearing loss. We have those types of hearing loss. Conductive hearing loss is one such hearing loss which Down syndrome children will all have it. Mostly Down syndrome children will have the conductive hearing loss, because like accumulation of fluid in the middle ear, it leads to obviously the name suggests conductive hearing loss. It's a conductive hearing loss. Okay. So we need to do every 6 months, once in 6 months, we need to do the audiological evaluation for the children with Down syndrome, so that we don't miss out any minimal hearing loss also. So if the child with we have a two hearing system in 2 ears. If the child is not hearing totally 90% of hearing loss in 1 ear, and the child has a total good capacity of hearing in the 1 ear, means obviously the child will start to use only the other ear, so that the other ear capacity also will go down, so that the 90% of hearing will also go down to the 50 or 60%. So the child has to be get balanced to the both ear. They should have the equal sense of hearing. So we need to assess all the hearing and all. Every 6 months we need to do the hearing test for the children with Down syndrome. So again, we are coming to the speech therapist. Like as I've already told, it's a dual degree, audiology and speech language pathology. So I've completed the audiology part. So coming back to the speech therapy part, I think this is the most important thing that most parents are waiting to hear. So here's a speech language pathologist is a professional. They are getting licensed from the Rehabilitation Council of India. They'll get a license. They are like they can practice in more sectors like swallowing, communication, language separately, speech separately. We can actually practice in a lot of lot of sectors. So these are some I've given some normal speech language milestones, so that you can see this. Normal speech milestones, you can just compare with the Down syndrome children. So you can assess how far the language age and the chronological age of the child is getting differed, because we'll be seeing while assessing the child, we'll be having the norms like this, the normal speech and language norms like this, and we'll be assessing the child with the Down syndrome or any other disorders like the children. We'll be assessing the children. So how far is the difference between the language age and the chronological age? So if the language age and the chronological age is more than 6 months, they need to be definitely treated. They have to be put under the speech therapy, and they have to be treated with only with the speech therapist. Okay, so these are all some normal speech and language milestones. From 0 to 6, well, from 0 to 3 months itself, the child will start to produce sounds like e, u, kind of a single syllable sound. They'll start to produce at 3 months itself. Not even 3 months, they'll start to make sounds even at 1 month. We can able to differentiate the cry between the child, whether the child is crying for the milk, or the child is crying for the potty. We can able to judge the differences even in the one month itself. So 3 months they'll start to produce some cooing sound. And at the 6 months, they'll start to produce sounds like ba 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 ga 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 ga, kind of a bisyllable sound. It is named as babbling. They'll start to produce it 6 months itself. They'll start to imitate whatever sounds we produce. They'll start to imitate. They'll start to give a good eye contact with us. They'll see our facial expression, all that will emerge around the 6 to 9 months itself. So around 9 to 12 months, they'll start to produce one meaningful words like amma, appa. Meaningful words will all emerge around the first year of age. Then that first birthday time, they'll start to produce all the meaningful words. So around 1 to 2 years, during the 18 months, they'll start to produce a word like simple sentences like "Mama come, Papa go." Simple two-word sentences they'll start to produce. From there on, every 6 months, they'll add on a word with the sentences like three-word sentence, four-word sentence. They'll start to produce it. Okay, here between the 1 to 2 years, they'll start a expressive vocabulary. They'll be having expressive vocabulary of 50 words. We wouldn't know that the child should speak about 50 words, 50 meaningful words. They should speak about 1 to 2 years. Okay, 2 to 3 years, they'll produce the 2 to 3 word sentences. They might start to ask the simple questions like what, who, where. They'll start to produce all these questions, and even before 2 to 3 years. At 4 years and above and all, they'll start to narrate a sequence. They'll narrate a simple story, narrate a simple incident which have happened in school or any other situations. If we ask them a question, they'll straight away produce the answer in 4 to 5 words in a sentence. So around these 4 years, 4 to 5 years and all, they'll start to have a expressive vocabulary of more than 5,000 words. They should have more than 5,000 words in their vocabulary. So why these milestones is important? Because like only if we identify early, we can treat early. It is all important because if we know the normal milestones only, we'll be able to differentiate it from the disabled people. So we will be able to differentiate the both things only if we know the normal thing. So we need to know about these normal milestones. So we'll see about the brief thing about the speech and language disorders, what all will fall under the Down syndrome children. So how can we help with the Down syndrome children? So first, the childhood language disorders. So there are a lot of things in the childhood language disorders, like early. There are two domains actually: comprehension and reception. Comprehension means whatever we talk, the child has to comprehend. Reception is that. Expression is the child has to process what we are saying, and child has to express things for that, express answers or something for that. Okay, so we'll be assessing comprehension and reception, two things in the childhood language disorder. The child has to have the not more than 6 months delay with chronological age. There should not be a delay between the chronological age and the language age. It should not be more than 6 months. If the child is more than 6 months with the reception age and the expression age, we need to put the child into speech and language therapy. And again, some children will have the reception age will match into the chronological age, but the expression age will not match into the chronological age. So the child will have the good reception, but the expression alone will not be there. So those children will be those children have to be treated separately. Like they'll be having good amount of comprehension, and they don't know how to communicate and where to communicate. They don't know the mode of communication, or they would have got the good chances to communicate, how to communicate and all. So we need to treat them separately. So again, coming back to the Down syndrome children, these children have to be treated early because every domain, all the motor domain and speech domain, are expected to be a delay in Down syndrome children. So we know all these children will again fall into the delay. So we need to put the children into the as much as possible at 9 months. 9 to 12 months, 9 to 10 months, we can start to treat, because at the 6 months, the child is about to babble. There itself, it's going to be a delay in the Down syndrome children. So we need to start the therapies at 9 to 10 months, because we expect the child to start to talk a word around the 9 to 12 months, right? So we need to start the therapy at the 9 to 12 months. Okay, this is regarding to the language disorder. Coming back to the fluency disorders, like after the child is getting, the Down syndrome child is getting older, after 12 years or 15 years, most of the Down syndrome children will fall into the stuttering problem. Too loud of word, the stuttering thing. because of the shortness of the breath, because of their physiological and anatomical thing and all. So they have the shortness in the breath, so they'll be having a stuttering. Most of the Down syndrome children have the stuttering thing. So we will be treating all those stuttering disorders and all in the adult and toddler children. And again, coming back to the articulation disorder is saying the wrong words, wrong sounds for the correct sounds. Like for a per, they might some words they'll pronounce in a different way. Say from some people, like say for lorry, they'll be saying a lolly. But like kind of it's kind of an articulation disorder we'll be treating. So we'll focus on the particular sound where the child has to like listen and produce those kind of a sound. They'll learn it in a way. So they'll try to produce in a correct manner. So again, coming back to the Down syndrome children, they have a precise oral musculatures and all. They have a bulkier tongue. They have a lot of anatomical things and all. So they have the because of their dental teeth and all also will never fall early. So we all these articulation disorders is also an important role will be doing in the Down syndrome child. And hearing, we would have already seen, we'll be fitting into the hearing aid and the cochlear implant, those things. Cleft lip and palate is the one more domain we'll be practicing in. Cleft lip and palate, have anybody heard? Have anyone heard about the cleft lip and palate?
Yes, ma'am.
Yes. Yes. So yes, most of the children's they'll be having a slit over the from lip to the uvula. They'll be having a slit. Or some children might have a soft palate cleft. There'll be only the slit inside the mouth. So these children will have a problem in the swallowing. They'll be from the birth. They'll be having a problem on the feeding. So after that, the surgical procedure will be done. They'll be correcting the cleft lip and palate, and we need to work on the swallowing thing, and they'll be having some speech sound disorders or not. We need to treat that. So that is regarding the cleft lip and palate. There's nothing more to do with any really rare cases with the Down syndrome with cleft lip and palate. There are quite not lot cases are there. Again, speech delays associated with other conditions like mental retardation, autism spectrum disorder, and attention deficit hyperactive disorder. Everything language, LD, CP, cerebral palsy, learning disorder, and all that. It's all associated conditions with the Down syndrome we'll be working on. You all would have heard about the ASD, ADHD, most of the children, MR. These are the three most conditions we'll be handling with the Down syndrome children. Because obviously Down syndrome children might have a little bit of mental retardation. And again, some children will be having the hyperactive disorder, some children will have a cerebral palsy, some children with a learning disability. Not all children, but most of the children will accompany these kind of associated conditions with their Down syndrome. So how far we can work with these children with the autism spectrum disorder and all? We need to interperspectively, we should work with the interdisciplinary team. So we need to for the ASD and all, we need to consult with the OT therapists, physiotherapists, special educator, and everybody will come into the role for the child. So we need to talk about the child. So what are all the domains we can separately work on? We need to focus on the one goal we have to take from each 3 months. We need to shift the goal. We have to work separately for each child with the interdisciplinary team. So these are all some associated conditions we'll be working on with the Down syndrome. So coming back to the speech therapy that is mainly focused on Down syndrome is we'll be focusing on morely speech intelligibility, the language comprehension, the expression in the various stages. Will be which I already told you, these are all the things we will be focusing on. Oromotor exercises and strengthening of the muscles for the speech clarity and all. Most of the children with the Down syndrome have the oral muscular capacity, low oral muscular capacity because of their anatomical thing, they have it. So all the speech language pathologists will practice on the oral muscular training. So we'll be having a lot of brushes and we'll be having a lot of talk tools and all. We'll be using that to strengthen the oral muscles to focus more on the child to speak. So, multi-sensory technique like visual and tactile cues to help the correct sound productions. So these are all some things. So, so this is the brush we'll be using for the swallowing and oromotor exercises to enhance the oral sensory thing and the oral muscles. So, what are all the tips to improve the communication in children? So, if the child is coming, the child is being like we have identified the child that the child is having some speech delay. So, how we are going to work with the child? So, coming back to the speech therapy, so we'll be sitting with the child. We need to 100% we need to engage the parents into the speech session because like they have to learn what is happening inside the session so that they can go and work on with the home. We need to give them the home program so that they can practice at home. So whatever we communicate with them, we have to give a lot of facial expressions in our face so that they can learn easily. They can catch up a lot of cues from our face. We have to do a lot of mouth opening techniques to practice with those children because they will visually learn what are how their tongue is moving, how the lip is moving. They'll learn in that kind of way. So that they'll easily catch out. These are the sounds. These were the place I have to place my tongue and I have to place my lips so that they will be learning easily. And again, engaging the parents into the session. We need to give a chance to the child to speak out. So most of the parents are not giving a child for the child to communicate before even the child is starting to communicate. We are like filling out their needs. Like for example, if the child is like coming to me, if the child is having a more than 6 months of delay, if the child is having a delay means I'll be asking one question for the parents. Are you allowing the child to speak out their communication or not? How they are communicating for their needs? How they are asking for the water? How they are asking for their potty? How they are asking for their food? They will be usually saying the child will be like showing out and pointing out something like this to the objects, and they'll be again, the parent will immediately will take out the things and all objects and all, and they'll give it to. They are like understanding in that way. They are thinking this is the communication which the child is communicating with me. I should understand in this way. The child will also think like this is the way of communication. I should point out to the object so that they will understand. So that I'll get it easier. So this is the thing most of the parents will do that is a very wrong thing. We should not encourage in that way because they will learn in that way. This is the communication. That is also a communication, but we expect a lot from the mouth. We expect the child to speak out. That is not the normal thing. That is also a communication, but that's not the normal thing. So we expect the child to open the mouth there. You just open your mouth, say what you want. You just say the object name. I'll just get it. You just say it in a word or you just say it in a sentence, I'll just get it. These are all some tips we'll be giving out to the parents. You should give a chance to the child to speak so that the child will know how to use the communication properly and all. And again, a lot of peer group interaction is needed for the children nowadays. Like most of the children are being put up in the home. They are being in a like quite hectic setup, going to the school, coming back home, going to the other classes, and coming back. Like no interaction between the child or with the normal group or any other people. It's not happening there. So with their age group only, they'll be able to like see what is the normal development, what the other child is speaking. I'm also expected to communicate in that standard. So I should also use those words. I should also use those kinds of sentences and all. They'll start to learn in that way. So these are all some tips you can just use to communicate with the children. So that's it. We are up to end of the session here.
Yes, thank
Answer the
you.
question.
Thank you so much, Yogeshwari ma'am, for yes, streamlining everything we should be keeping in mind as parents with person with Down syndrome. That very important point that we have once we are identifying the speech pathologist or the audiologist for a child, we should see that they are whether they have a license holder or they are registered with RCA. Very important point. And I think with very fleshy setup and everything, sometimes we tend to forget those kind of aspects, right? So yes, it is important. And yes, putting it across in a very nice way, which was easily understandable, and mentioning that what are the typical milestones, because knowing only will make us look for the delay, right? And we need to keep reminding to ourselves that these are the milestones we are looking forward, and if it's not happening, we need to see an expert. And also mentioning those compulsory recommended tests for audiology, so that hearing loss can be identified, that how much hearing is there, or if both the ears the hearing is not there, or if any problem is there. And yes, we do have that fluid accumulation in our children, and there are many parents who really come across this problem, that it is always leaking, and the air is leaking,
Yeah.
and there is because of that there is a temporary hearing loss. Yes, ma'am, you also mentioned that before we open it for others, that when you're talking about the auditory test, vagera, you've mentioned that every 6 months the test of hearing should be done. I think it is still we establish that hearing as stabilizes, or it is recommended who has got some problem in ear or uses an aid, so it has to be done 6 months.
It is recommended to do it for every children because like it is being left off. The unilateral hearing loss is like quite often left off everywhere, and the minimal hearing loss is quite often left off because like it's minimal hearing in the sense like most of the children nowadays are being visually attending classes and they are using a lot of use of
Yes,
headphones and all.
yes,
They
and
might fall into the minimal hearing loss and all. So we need to do
okay,
every 6 months. Like for us and all, we'll be able to like we'll be like for I don't know whether for
yes,
normal population itself, we all don't know whether we have a normal hearing capacity or not. So we'll be
absolutely,
definitely having like either in one
yeah,
year we'll be
yeah,
like having a good hearing capacity, and here the other year we'll
yeah.
be having quite little low capacity. So we need to like every children with the
Identify.
Down syndrome we should have the every 6 months audiological evaluation. It's quite little important to do everything,
Yes.
even at least until 12 or 13 years
Yeah.
because the language development would have attained before that,
Absolutely. Ji.
so that it will be easy for them to doesn't enter with their developmental thing and all that.
Yes, because what we listen, it is easy to articulate, or easy to
Yes,
reproduce. So
yes,
listening is and I can relate to this fact because my husband is a low pitch deaf. Like in a very low pitch, he is not able to identify. So, and having a low pitch and high pitch, are different concept through
yes,
audiology. It
yes.
doesn't identify by low money. It will be like this, and high money, it will be too high. So
Mhm.
yes, hearing
So
loss, yes,
there comes the
maybe.
audio articulation problems and all. So if the child
Yeah.
is having the low minimal hearing loss and all, the child will miss out all the low pitch sounds.
Yes.
So there the
It,
child is missing out all those speech sounds, and there comes
yeah.
the articulation problem.
Yeah, and that is related to auditory processing also, that
Yes, yes,
how you
yes,
process, you tend to take out.
yes,
That's how we also have regional differences in language. Like when I speak English is with a different accent, when we go down south, or
yes.
towards
It's a different
extreme
thing.
north south, it's different. So
It's a
yes,
different thing.
that's a good fact to know. Brinda ma'am, can you help us to stop this slide so that
Yes,
we can
Sammy,
have more
actually,
people?
I was just about to say, Yogeshwari ma'am, if you can just
Yes, yes.
switch on the slide.
Ah,
Thank you.
Thank
Yeah.
you, Riddhi. So, yes, we'll be taking up Anita's question first. It has come in chat box, and I'll be reading it for the later purposes because we are live on YouTube. So those who will be watching us later should know. So it says that, hello, ma'am, my son is 3.5 years old and able to speak some words, only not tough words, and not able to speak sentences. What can we do?
So how
Anything?
far he is
Uh,
speaking in sentence, how far his expressive vocabulary is there, we
yeah.
need to know all that. Like without
Yeah.
knowing all these things, we can't
Yes.
help.
Do you
So
want to ask something? The parent is here. Anita, can you unmute yourself?
Yes, ma'am.
हाँ.
Hello,
हाँ.
Anita.
Yogeshwari ma'am, you want to take more input to guide a parent a little bit or make the
Yes,
parent
yes.
understand what is the current state?
So the child is 3.4-year-old, right?
3.5-year-old. Yes, ma'am.
हाँ.
Okay. So how far he will communicate his needs and all? Like if he
He's
want his food, how far he will communicate?
like mama, papa, dada, dadi, bhaiya only.
नहीं,
Meaningfully, he will utter all those things, mama, papa, and all.
Yes, ma'am. Yes, ma'am. Mummy, papa, dada, dadi, bhaiya,
हाँ,
didi,
हाँ.
like these words only.
Okay.
अनीता वो अपनी जरूरतों को कैसे एक्सप्रेस करता है? अगर उसे कोई चीज चाहिए या वो कुछ उसको महसूस हुआ या कुछ उसको एक्सपीरियंस, वो कैसे एक्सप्रेस करता है? वो ये जानना चाह रहे हैं योगेश्वरी मैम शायद.
Okay, ma'am. That time he used only sign language.
Okay. He'll only point out and describing
Yes.
any experience or anything he wants,
If he
like you were
wants
mentioning.
anything, he only points out the that things.
Will he completely use the sign language? Is he like trained up on using in sign language and all?
Yes, ma'am. He's
वो साइन
using.
लैंग्वेज उसको पूरा लाइक देयर इज अ टोटल डिफरेंट एस्पेक्ट ऑफ इंडियन साइन लैंग्वेजेस और द अदर
Yeah.
काइंड ऑफ साइन लैंग्वेजेस वेयर विद द जेस्चर ऑफ हैंड्स वंस कम्युनिकेट. अनीता, जब हम हाथों की मदद से बताते हैं, पॉइंटिंग आउट एंड टेलिंग हिम,
That is a different
दैट
thing.
इज समथिंग यू हैव इनोवेटेड, है ना?
Yes, ma'am.
तो उसको अपने इंडियन
Okay.
साइन
So
लैंग्वेज.
for his need, he is asking like that. So if he wants food now, he is pointing out to the object and he is asking for the food. So if he is asking like those kind of a thing means he is having some expressive vocabulary. That means he is
Yeah.
having a speech. So he used the speech. So he might, to my assumption, she asked for her saying like he might have some 20 words or something in his vocabulary. So we need to elaborate that vocabulary. We need to expand that vocabulary. That's it. So whenever he is asking for the food, you just ask him to say like "Mama give," "Papa give." You just make him to say in a two-word sentence.
Fill
So
in
that
for the child. Yeah.
yes, we need to give him a chance to utter that. If he is not opening his mouth, just ask him to say. You just say it 3-4 times. He will just slowly understand. First, definitely he'll throw his tantrum because like he would have understand in a different way that this is the communication, and suddenly you're striking out everything and you have to make him to utter in a mouth means he'll definitely show up some tantrums. You need to just hold up all those tantrums. Definitely you will learn and you will just start to use out the
Can we,
communication.
can we use, ma'am, speech therapy for him?
Yes, definitely you should see because the child chronological age is 3.4. And to my thing, as per your saying, is language age is almost 18 months or 12 to 18 months, definitely. So he's obviously falling out into the two plus more years of delay. So you should definitely seek a professional help.
Yeah. तो अनीता, आपको ढूंढना पड़ेगा कोई स्पीच थेरेपिस्ट एंड उनके साथ में मिलके काम करना पड़ेगा बच्चे पे.
So it is definitely much important to adjust those gap between the chronological age and the language age because for the normal development, it is really important to adjust these gaps.
Yes.
So that only the child can fit into the normal stream.
Okay, ma'am. Thank you so much, ma'am.
Yeah. Okay, thank you, Anita. So,
Thank
ma'am,
you, sir.
the next question, again, I'll take some chat box and then come to Madhav. It says, does toys and motor skills enhance speech? If so, what kind of toys are recommended?
Toys, it all depends across the ages. What sort of toys will the child love to learn play with in the because if you give a pegboards and all for the 1 year old child now they can't do. So it all depends for the age where the child can play with the different toys. Like for the 1 year old child only can play with the jiggles kind of a things and can put a blocks or building blocks or something like that. Only because of their motor development, they can only play with those kinds of toys and all. After 3 years, we can give the pegboards and all small pegboards. We can teach them to just do it over there and here. They'll slowly learn it and they can only these 3 finger motor fine motor development is have achieved only means we can the child can easily do all those pegboards and all. Any other toy which we recommend is using of a lot of flashcards for the children's. For less than 1 year itself, we can use up the flashcard because the child will allow to see the pictures You can start to show a lot of cards for the children's, like kind of a lot of flashcards are available online nowadays.
Yes.
You can just buy all these alphabet flashcards,
Yes.
fruits, vegetables, all those lexical flashcards. You can just buy it out and just teach it with the child. Just don't bombard with the child to like with the flashcards alone. You just
Yeah.
have to show what is this and just help the child to utter it. What is this?
Yeah.
Ah, 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 ah. Oh, so
Yeah.
that the child can see this. The child brain is it's kind of a, like quite a little tougher for us, toughest thing for them to understand what are the movement which is happening inside the mouth.
Yes.
So we need to slow down to their level so that they will understand
Yeah.
it easily.
Yeah.
Whenever you are talking with the children, if the child is a as she said, 3.4 4-year-old children, but his age is around like 12 to 18 months according to his language.
Yeah.
So we need to convert ourselves to a 1-year-old child. Imagine
Yeah.
ourselves as a 1-year-old child, and we need to talk him in that way so that he will understand. So he'll treat us his partner so that he will communication will be easier over there.
Yeah, so nicely put across that we really need to get down to the level of the child where the child is able to communicate, and flashcards really helps. It is like visual learning, and our children are
Yes.
champions of visual learners. I mean, they will not falter if they have set that picture in their mind that okay, this was shown and this is not right, this is wrongly put. They will do it. Yes. Then we come to Madhav. Madhav, if you can unmute yourself. I mean, that's the name reflecting. I don't know who is behind that black screen. Madhav, if you can unmute, you have raised hand. Okay. Priyanka, you are able to unmute. Please ask, unmute yourself and ask.
यस मैम, मेरा
Okay.
क्वेश्चन ये है कि मेरी
We'll
बेटी
take Madhav's question after Priyanka. That person has typed it in the chat box. Yes, Priyanka, go on.
My daughter Samaya is 7 years old and she speaks some words as mama, ma, mummy. Now these days she is saying me continuously mummy, mummy. मतलब जब उसको मैं नहीं सुनती हूँ ऐसे माँ कहती है, और तो मम्मी उसने ई की मात्रा का मैंने कभी तक कोई एफर्ट ही नहीं किया, बट शी इज सेइंग मम्मी एंड पापा आजा, कम, गो, बाहर, बाहर चल, बाहर चल को कहती है बाहर चल, ओपन, कोज, क्लोज को कोज। समाया जैसे उसका नाम है, वो सा मैम नहीं बोल पा रही है, बहुत सारे शब्द हैं, ला नहीं बोलती है, मतलब बहुत एफर्ट बहुत कर रही है इन दिनों। वो लास्ट 3-2 मंथ से कंटिन्यूस शी इज एफर्टिंग कि वो बोल के, पहले जो साइन लैंग्वेज 90% था बोलने का, वो अब कम्युनिकेशन हो गया है, 10%
Lovely.
साइन लैंग्वेज हो गया है। लेकिन
Congratulations, Priyanka.
थैंक यू मैम, इट्स ड्यू टू ओनली ऑल हम सफर्स विसेज। एक दिन वो था जो बस वो एक ही वर्ड बोल पाती थी। इस ग्रुप से मैं ना जुड़ती तो आज मैं यहाँ तक ना
तो
पहुंचती।
आगे भी
Yeah.
हो जाएगा प्रियंका, वो अल्लाह
Hi,
हाँ,
Parul.
मैं पॉजिटिव हूँ,
तो
बहुत पॉजिटिव हूँ। बस मैं सबसे शेयर करना चाहती हूँ अ बिग सॉरो इन माय लाइफ। अभी 7 अगस्त को मम्मा मेरी रहती थी मेरे साथ, नाउ शी इज
Oh,
नो मोर।
oh,
उन्होंने ही उसको
our
यहाँ तक
condolences.
पहुंचाया, उन्होंने
Yeah,
ही। मैं
yeah,
तो जानती भी नहीं थी एक एक चीज को वो, और फिर बाद में दुख भी, गुस्सा करती थी जब मैं स्कूल से आती थी। पता है मैं कितना बोलती हूँ, मैं पूरी लाइफ में इतना नहीं बोली जितना अब बोलती हूँ,
yes,
बट नाउ
बिल्कुल।
शी इज नो मोर, उनकी ब्लेसिंग से। अब उसका
yeah,
ये हाल है मम्मा के जाने के बाद, वो मतलब उसका सारा ध्यान ये रहता है कि ये मेरी बात समझे मैम।
yes.
और बहुत सारे वर्ड्स ऐसे होते हैं कि मतलब मैं भी अनेबल हो जाती हूँ समझने में कि ये क्या क्या। फिर पता है उसका क्या एक्शन रहता है,
Ah, it's
ये
coming
कर
back to
रही
you.
हमारे
You
बच्चे
must have repeated it so many times. Yogeshwari ma'am, I wanted to share that you mentioned about peer learning for our children. Peer learning at any stage, ma'am, for our parents also. From each
what
other also we learn.
now on
This
this
is what
stage
Priyanka is
ma'am, what can
mentioning.
I do, what can I do कि I am unable कि my child is want speaks more words, but बहुत सारी, जैसे समाया उसका नाम है, मैं कितने दिनों से हम लोग सिखा रहे हैं, सब एफर्ट करते हैं। एक बच्ची है अदम्या, तो वो उसके साथ खेलती है, तो उसका नाम वो लेती है अमिका, अमिका। उससे पूछो योर नेम, वो बोलना चाहती है समाया लेकिन अमिका। मम्मा नाम प्रियंका, बहुत टफ नेम रख दिया, प्रियंका नहीं बोल पाती, तो मम्मा नाम मम्मी, मम्मा नाम मम्मी। और बेबी मेरा निक नेम मेरी मम्मा
She
कहती
would have
तो
learned in that way that
Yeah.
your name is mommy.
Ah.
She would have learned in
हाँ
that
बट वो
way.
माई निक नेम बीबी कहती है, वो बीबी। बेबी नहीं कहती, ए
baby,
मात्रा
not baby, but baby.
बेबी। तो और मैं
Yeah.
इम्प्रूवमेंट के लिए व्हाट कैन आई डू? आपने आर्टिकुलेशन
There's
का
certain,
बताया मैम,
there's certain sounds she's mentioning that child is not able to make, like the name is Samaira, but
जिसमें
first
टंग ऊपर
syllable.
जाती है, वो
Yeah.
टंग जिसमें जाती है वो लेटर उसका नहीं निकल पा रहा, वो क्लियर नहीं हो पा रहा उसका बिल्कुल भी।
Anything you want to suggest for
You
home
need to definitely see a speech therapist because like we need to see a child first,
assessment?
like
Yeah.
so that we need to assess the child first. So what sort of sounds is like it's not coming and which places it's not coming. So we need to clearly assess all those things so that we can help out the children. So that we can help
वी
out the
शुड
child.
गो मैम फॉर डेंटिस्ट, फॉर
No, no,
No, no,
ओरल
no.
speech therapist.
So
स्पीच।
Priyanka.
the teeth is proper, right?
हाँ, टीथ उसका मुझे लग रहा है अभी उसका निकलना शुरू हो गया, मिल्क टीथ 2-3 निकल
But
गया
that
उसका।
is not going to totally going to hinder totally all those speech sound is not going to hinder because of that reason. You can just directly go to the speech therapist. They can first see the child. If the child needs to seen by a dentist and all, there she can suggest so that you can go and see a dentist. First,
मैम
you just go.
यू कैन सजेस्ट मी एनी स्पीच थेरेपिस्ट इन नियर बाय दिल्ली और दिल्ली। एक्चुअली आई एम ना 150 किलोमीटर फ्रॉम दिल्ली, दैट इज अ वेरी रूरल
Okay.
एरिया वेयर आई एम लिविंग।
It's
Okay.
आप
yeah. Yes,
आ,
Parul.
आ, आपने जैसे बताया कि आपकी मम्मी अभी नहीं है और वो उनसे बहुत ज्यादा बात करती थी, और आप, मैं जानती हूँ आप वर्किंग हैं, उतना टाइम बच्चे को नहीं दे पाएंगी। पहली बात तो बच्चे के अगर वर्ड्स क्लियर नहीं है, शब्द क्लियर नहीं है, तो उस पे हमें कोई टेंशन नहीं होनी चाहिए, हमें समझ में आ जाना चाहिए बस वो उस बात को बोल रहा है कहीं यूज
Yes.
है, इसका मतलब कॉम्प्रिहेंशन है, उसको समझ
Yes.
में कहाँ यूज करना है। तो उसे क्लियर करने की बात आप छोड़ दीजिए, ये टाइम के साथ अपने आप क्लियर हो जाएगा, मैं आपको गारंटी देती हूँ। दूसरा,
लेकिन मैम बहुत सारे लेटर नहीं निकल रहे हैं, वो मुझे पता है,
Wait,
जिसमें टंग ऊपर
Priyanka,
जाती
let Parul finish. She is still
है। ओके
waiting.
ओके।
Bolo, bolo.
हमारी जगह आ जाओ तुम, हमारी जगह प्रियंका आया करेगी।
Yeah, Priyanka, we give time, है ना? Whosoever is talking. Yes, Parul, we
पड़े।
come to you.
दूसरा, आपको उसको कोई भी उसकी पसंद का या फिर उसे इंट्रोड्यूस कराए नए नए टीवी शो से या किसी उससे, एक उसका पर्टिकुलर टाइम रखिए। मैं जानती हूँ स्क्रीन टाइम बच्चों का नहीं बढ़ाना चाहिए, लेकिन क्योंकि हमारे बच्चे देखते फिर भी हैं, तो एक ऐसा प्रोग्राम, चाहे वो कार्टून हो, चाहे वो बच्चों के प्रोग्राम जो होते हैं तारक मेहता का उल्टा चश्मा या इस तरह का, जो भी बहुत सारे उसमें, क्योंकि बच्चों की जरूरत के हिसाब से सोशल मैसेज भी होता है और बहुत सारे
Yes.
जो बच्चे उन्हें सीखते हैं एंड कॉम्प्रिहेंशन सीखते हैं कि उसे कहाँ और कैसे यूज करना है। तो आप देखेंगे कुछ ही महीनों के बाद वो ऐसे ऐसे वर्ड्स और ऐसे ऐसे सेंटेंसेस बोलेगी जो आप कहेंगे अरे ये इसने कहाँ से सीख लिया। तो वो जो मदर के साथ इंटरेक्शन था उसको आप थोड़ा सा वहां शिफ्ट कर सकते हैं, इसे यूज करके देखिए, ये काम आएगा। स्पीच थेरेपिस्ट को तो आपको मिलना ही है, जैसा कि योगेश्वरी मैम ने बोला।
Mm-hmm. One of the senior parent is also advising for helping the tongue move. Keep all her favorite, licking things around her so that she'll
Yes.
keep.
या टंग एक्सरसाइजेस आई नो
Yeah,
मैम,
but we are very happy to know, Yogeshwari ma'am, that the child is making an effort to communicate, and
कंटिन्यूअसली मैम।
when,
The child will get to fed up actually if we are asking
यस
again and
यस।
again what na means because the child will easily get fed up. Okay, why should I
yes,
tell again?
so
If they are
add
not
on
listening
more.
to me and they are not
Ah,
understanding me, why should I communicate? The
Her
child will get into
expression
that
is
point.
she shows expression why you are not understanding. I am
Ah,
ah,
showing continuously, I am
yes,
saying continuously.
yes,
you just keep your face that you have understood well.
चलो
If you are showing those sort of expression, na they'll start to communicate itself. Okay,
yeah,
why should I communicate in that way? If you're not
yeah,
understanding, why should I communicate?
yeah,
You just assume that you are understanding everything, or you
Understanding.
just seek another way to like what you just make her
yeah,
to write, or just seek another way to make her to
yes,
communicate, make you to understand what she is saying.
yes,
You just seek that, and then we
yeah,
can correct it. No issues with correcting. We
yeah,
can just we need to like broke out that point
yeah,
that the child should never get fed up over communicating.
yeah,
बिल्कुल
Thank
सही।
you.
yeah,
कि हमें ये दिखाना पड़ेगा कि ऐसा नहीं होगा कि हमें नहीं समझ आया है, हमें ऐसे दिखाना
yes.
है।
हाँ, I show positive है ना gesture कि I am understanding, I am understanding.
Good,
आप
very good,
सैमी
very good.
Parul, आपका voice आ रहा है और जा रहा है, so I think that's how we are not able to communicate. We know, do you have no problems with your speech? It's your microphone. So this one, a few we take, this hand is raised and Madhav with name of Madhav, and it's the question is also in chat box. I'll read the question from the chat box first.
Yes.
That ma'am, child is 5+ of age, and he says some words, but use mostly one letter, like B. Like if the name is Soumya, he says Bobea. I don't know, some spelling mistake is there or something. I went to some speech therapist, but they said he will speak by himself as he is very active child and he learns fast, but didn't sit on one place. So it becomes difficult for them to make him sit at one place. So what I should do? So it is something to do with sitting tolerance. Madhav, if you can unmute yourself, ma'am, if you have understood something, you can add on for parent to guide.
So the child is almost 5+ years. To my understanding, as per the question is like the child is having only one word in the utterance. Like the child is not making any sentences. Am I correct in that
Yes,
way?
yes, ma'am.
Madhav?
Yes,
Correct,
ma'am.
right? So the child is using one word to communicate. For everything, the child is using one word.
Yes, ma'am.
So you need to elaborate the sentence. You have to make the child to speak in a sentence. You need to focus mainly on that. If the child is speaking wrong, the child is like saying the speech sounds wrong, it's also fine because there's a language itself is being a delay. Was to focus morely on the speech sound. If the child is saying, okay, so you just focus the child. If the child is asking for his needs, or if the child is saying something in one word, just make the child to say in a sentence. If
Okay.
you understand, right, what I'm saying? Like, you just make the child first. First, the child will never speak in. If the child is speaking only one word, the child can't speak in a 5 or 6 words at a sudden, at all of a sudden. So we need to like focus. If the child is speaking in one word, we need to build it to a 2 word, and then 3 word, and then 4 words. Slowly, we need to add on a word with a sentence. Slowly, only it will get to develop. So for the child is now using only one word means you need to make the child to use 2 words per sentence.
Okay, ma'am. Ma'am, the problem is he didn't use his tongue too much. Just his lips are moving. He used only lips of words on
Only
tongue.
Because it's
uses
easy for
lips
them
to
to
speak.
use. Because it is easy for them to use because they are seeing only the lips, not more the tongues they are seeing. Because they understand in that way only the lips is used to communicate. The lips is the only thing it is being produced for the sound. So they'll understand in that way. You just have to make yourself very in expressive manner. You need to open your mouth when you're talking with the child. You need to show how the tongue is moving. You need to you just need to sit with the child in front of the mirror just to show him how your tongue is coming out and going in, how the tongue is moving this side, that side. You can rotate your tongue like this. You can just give a lot of positive reinforcement to move tongues and all. You can just lot of chewy things, lot of lickable things to give so that he can move his tongue freely.
Yeah.
Okay.
And last time in a session, we also come to that understanding that if there is a tongue tie, because one of the 13-year-old child, the query was asked that the child is not able to eat in a way that if the food is here, so the tongue doesn't go to the cheek. Yeah. So I think Yogeshwari ma'am, we should be also seeing for the tongue tie with the.
Yes. Obviously, we should need because the tongue tie is also plays an important role in speech sound disorders also because if there's a
Limits.
tongue is
Yeah.
tough over there, no, they won't be produce all the lateral sounds and all.
Yeah.
So they need to be removed by a general surgeon. They'll be removing it, and we need to give some proper therapy post surgery, so that they can learn how to use the tongue
Yeah.
for the movements and all that.
Yeah. So Madhav, you really visit a good speech therapist around you, or take an effort to go, if not nearby, to some place where you can actually find out other aspects of not being able to move the tongue. So
For
coming to
everyone
this,
who
yeah,
needs
yes,
speech
ma'am.
therapists all over India, like you need a speech therapist now, you just share my number. They can just freely WhatsApp to me so that I can put their needs over the group. There is a group all over India actually. We all the speech therapists is there in that group. We can just post it over in that group so that someone in that area or someone, if there's a center nearby, they can just communicate. They can just go
Yeah,
to the center.
yeah. I think Brinda ma'am will help us with that. Ma'am, with the
Sure,
Yogeshwari
sure.
ma'am, if you can take, and you can circulate in all the groups. So
Yeah.
this is one question got skipped. It says that obviously there's no limitation, but it says that is there any limited time for the child to learn speech? As my child is 13 now and he speaks little words and can't do conversation.
Okay. We will be seeing only until 7 years because the rapid neuron movement will happen, rapid brain development will happen only until 7 years. Post that, the development will be there, but there will be a little bit slowness in the development. So we'll mainly focus on the child is under 7 years of age. So we'll mainly focus the child to speak over the mouth. We'll just focus purely on the mouth. After 4 to 7 years, we'll be focusing more. If the child is not speaking, we'll take that to a non-verbal communication. We'll be using AAC, that alternative and augmentative communication, or picture exchange communication system. Lot of things are there, or sign language is there. We can use a lot of things there to make the child communicate. First, the thing, every individual has a right to communicate in whatever way they are communicating. They should communicate.
Yeah.
They all have the rights to communicate, but we need to show them the right way, show them the right path to this is the way you can communicate in this way, this thing you can communicate in this way. There are a lot of children who use multiple mode of communication for multiple things, so we need to teach all those things now.
Absolutely.
Ma'am, can I ask a question, please?
Who is
This
this?
was a question from me.
Yes, please. Where are you?
I am here, ma'am.
Brenda, can we see the parent? Kabir Gawa. Yeah.
Yeah, that's
Yeah.
हेलो मैम.
Yes,
एक्चुअली
hello.
मेरा बेटा जो है वो मतलब बात कर लेता है व्हेन ही कांट स्पीक, या उसको लगता है कि मेरी बात नहीं समझी जा रही, देन ही गॉट इरिटेटेड कि मैं इस बात को मतलब इस तरह से इरिटेट होगा कि आप मुझे अंडरस्टैंड नहीं कर रहे. वो कोशिश अपनी तरफ से बहुत करता है कि मैं हर चीज को क्लियर कर दूं. क्या ऐसा भी कुछ मतलब मैं उसको ज्यादा हेल्प आउट कर सकूं चीजों में उसको, मतलब स्पीच के लिए तो मैं उसको गैदर कर ही रही हूँ मैम लास्ट 2 ईयर से. अ, और किन चीजों में मैं खुद उसकी हेल्प कर सकूं ताकि वो बेटर लर्नर कर सके अपने आप को. ही ट्राइज टू सिंग सॉन्ग्स, वो बहुत लंबे लंबे सुर में कोशिश करता है मैं गाऊं, बट बिकॉज ऑफ द वर्ड्स कांट मूव आउट, उसकी टंग बहुत थिक है जिसकी वजह से उसके वर्ड्स बाहर नहीं आ पाते हैं. तो मैं उस उन चीजों में उसके लिए क्या हेल्प कर सकती हूँ मैं?
So the child, again coming back, like the child will easily get frustrated if you're asking so much of like thing, if you're not understanding, like for a lot if you're asking like what is that, what you have told them, the child will definitely get frustrated and the child will never come into that situation again itself. So you need to first understand, like to making the child easy for them to communicate, easy like that they will see us as a they are communicating good, so that they will understand me also, so that I can communicate to themselves. So they'll seek in that way. So we need to first understand them, what they are like. We will be like mostly understanding, like we will be like what is the situation. We'll definitely like over 50 to 70% we'll be able to understand what they are trying to say. We should not probe in more into that. Like what you said, what you said is not clear. What you should say me again, say me again. You should not say it like that. If you're understanding that, it's okay. It's fine. You need to retrace it to them. So you can say it in a better way like this. You can just put your words like this. You can just say it in a sentence like you can just help them out like this. But you should never ask them to repeat over things again and again. So that it won't give them a good thing to communicate, good way of communicating.
Yeah.
So
adding language to the sign of the child, adding language in the sense that the child is trying to communicate. अच्छा आप ऐसे बोल रहे हो, ये बताना चाह रहे हो, अच्छा ऐसे इधर नहीं जाना है. So what is happening, even if you are not understanding, you are making that connection.
Yes.
If the child says no, ये नहीं मेरा कहने का मतलब, ये नहीं मैं बोलना चाह रहा हूँ, मैं तो कुछ और बोलना चाह रहा हूँ, but the child will understand that okay, she is reaching somewhere, you know. So that Pictionary game, you know, you try to point out, give some cues, and
they will understand
guess.
that you are their partner to communicate. They will feel free to communicate with you more frequently.
Yeah. And the connection is more important. Otherwise, without connection, correction is a authority. It's a power. Then the frustration comes, and it is very frustrating for me also when I'm trying to say and I've not unmuted myself, and it's like, oh my God, I've said so many things. How I'm going to go, say again,
Yes.
So,
It's kind of like that one.
Yes, approach should be serious, but don't leave the fun part out of it. Otherwise, it
Yeah.
will get more overwhelming for you. And उससे ज़्यादा आप frustrate होगे कि as a mother, I'm not able to understand. That is
Yes.
more than
Ah.
actual, the difference,
Yes,
understand.
that's there the thing. All these things and all like come
Yeah.
over.
Yeah, and that gets communicated. और फिर वो build up होता है. So you are doing good, Kabir. I don't know that's
Yes.
your child's name or your
That,
name, but
yeah,
thank
that's
you.
actually he was using it for his classes.
Understood,
And today I have
understood.
used it first time. So I have
Yes.
already asked Kabir कि ये change कर दो
No,
with
no,
my
thank you, Kabir's mom. So we do
Nice.
have still more questions. Parul, what should we do? And we have already overshot time. So please
Okay.
tell us what should we do now. So ma'am, Yogeshwari ma'am, we still have some small questions and a large
Yes, yes, ma'am.
question.
We can just.
So how long should the oral massage should be done? This is asked by one of the parents. How?
It's all each exercises should go up to 10 sets. I don't know, like everybody know the speech oral muscles strengthening training or like retracting the muscle for 10 times. Like I usually suggest like doing all these exercises 3 times a day, post or after before the meal. Half an hour gap should be there because like we'll be putting out the vibrating brush and all that into the mouth, and so that the child may gag out. So we need to give a half an hour time before the food or after having food. After half an hour, we can just do the massage. I usually suggest if the child is drooling, so much of drooling is there, the child is not even able to swallow or food properly, the child is not able to move out the tongue properly, I will just suggest 3 times a day. But if the child is okay, the child is not like only chewing alone is not there, only the child tongue is being out, not too much of the drooling is there, I'll suggest 2 times a day or 1 time a day.
Yeah.
Only
So
I'll
like
just
how many repetitions? If I'm
10
doing
times.
this 10
This
times,
repetition is
that's it?
10 times. This
Okay.
repetition is 10 times. This thing is
Yeah.
10 times. Crossing
Yeah.
over. And all this is 10 times.
Yeah. I think after that,
And
उससे
we
ज़्यादा-
need to give a lot of good pressure in with
Yes.
the tip of the fingers so that they can feel it.
Yeah. And please to take guidance in person with your expert nearby you, because sometimes we don't know if the teeth is troubling and we are
Yeah,
trying to
it all depends on the age of the child.
Yes, age of the child. Yeah.
The child
So
is like
guys,
6 months
yeah.
now, we can't do it that much of pressure, and we can't do it that much of things.
Yes. Yes. So do it, start it with under the supervision of an
Yes,
expert.
therapist.
So
Yes.
there is a question. It says, my son is 12 years old and he talks, but in a very low voice. Please give some tips to improve the pitch, the loudness.
So we need to see why the child is speaking. From the initial age itself, we see. Can you unmute that parent?
Vashni, you are there. Can you unmute, my friend?
Yeah, good evening.
Hi, Lakshya Reddy.
Yeah, hi, good evening. Actually, sometimes when he's confident, he talks very loudly, but some things, like when we ask some things, he will tell in a low voice. That already clarity little bit is missing, and in a low voice, we are unable to understand. So we always tell little louder like that. So if he say some louder, so that we can able to understand what he says.
We need to understand if he's shouting loudly means that his vocal cords are good. Nothing
Yes,
to do anatomically.
sometimes when he is
Well,
confident, like when he wants something, he will say clearly and loudly. But sometimes, if you want to say something regarding some what happened, when we ask something what happened in school or something like
if the
that.
child is being put up in those kind of a situation, if you yourself like being and going and standing in front of any higher authority or something, like you will definitely have that those kind of fear, and you will
Not in the
definitely stammer
school,
yourself.
no, at home also. At home only, I'm telling. When we ask something at home, like
Nahin, Subhashini,
some
how much
situations.
correction you make when he's trying to speak, or how much no's you say when he's trying to communicate something, or how
It's
much
all.
disagreement you show when he's
No,
trying
no.
to talk something, because that has a lot to do with your voice,
Voice.
the loudness of
No,
your
no,
voice.
The
nothing
child
like
still
that.
doesn't have any confidence to speak with you. I should say it in that way. The child should
Yeah.
feel comfortable with the environment. The child should seek, okay, this is okay for me to say in a loud voice.
Yeah, in
Okay,
general.
nobody will. Okay.
Yes,
Yeah.
Subhashini. Yeah.
Nobody will
Like
question
in
me.
general conversation only, I'm saying general conversation also sometimes he tell in a low voice. So we always tell him little louder,
Just
so that
don't
we can
correct him,
understand.
actually. Just don't correct him. Just so don't say in louder, just a little bit louder, little bit. Don't say it in that way. You just start to speak loud. You just start to speak with him a loud voice. He will start to produce loud voice. He will understand in that way. So if the child might understand this is the home situation. There's only 3, 4 people is there. It's kind of a calm situation. I should speak in a like the child might learn in that way, or somebody would have told in that way also to the child. You have to calm down yourself when you're going out. You are seeing a lot of people. You should calm down yourself. You should not shout over there. The children are being put up in that situation. So they don't know where to use loud voice and where to use slow voice.
Yeah,
So you need to you just yourself use the loud voice
modulate. Yeah.
situation in your home. So that slowly you will understand. Just don't correct the child. Don't speak in try to speak in a high voice and all that. You just try to. Everybody in the home just try to higher voice. He can slowly pick out.
Yeah.
Yes, ma'am. Okay.
So
Thank you.
he'll mirror, or let him speak to me, Subhashini. So, and then we come to another question. Yes,
पता
yes,
है
Father.
कि उनको धीरे ही बोलना है, उनके दिल का मौसम है। आज हम धीरे बोलेंगे तो हम धीरे ही बोलेंगे।
Time
आप
बाद.
बोलना चाहते हो कि जो
I don't know. We must see if our auditory processing is working well, or we have gone into some hearing loss or some fluid accumulation or wax accumulation. Taking it in a lighter mode so that we don't get too serious about it. So another question comes that, ma'am, my child is 2 years and 7 months, and you are understanding Hindi, Yogeshwari, ma'am. I'll read it like that only.
I don't actually totally
Okay,
understand.
okay, I'll
Hindi,
translate, but let me understand first. वो सब बातें समझता है, he understands everything, और इशारों में बात करता है and speaks signs only, हाँ. So, but जब मैं उसे वो word बोलने को कहती हूँ तो नहीं बोलता. Of course, when I try to ask the child or prompt the child to speak the word, the child doesn't speak. वो दी को गीगी और मम्मा बोलता है. ओके, एंड पापा नहीं बोलता. पता बोल पाता. कितना भी ट्राई करो, हमारे एरिया में कोई स्पीच थेरेपी सेंटर नहीं है. दे डोंट हैव एनी स्पीच थेरेपी सेंटर नियर बाय, एंड इज नॉट एबल टू स्पीक द वर्ड लाइक पापा. But for D, I think go Gigi. I mean, I think Didi is addressed to the elder sister, so he says Gigi, and
Gigi.
and Mama he can say, but not Papa. And they don't have any speech.
So he's 2.7 years old. He
Yes.
is expected to speak around three words in a sentence now. So he
And
might
do you
have
give
started.
online consultation? That is also been asked. Yes, ma'am.
मैम आई
Okay, I
वांट टू
do give
इंटरफियर
actually.
वन थिंग सेम हियर। समाया पहले गिगी ही बोल रही थी, अभी 6 मंथ से उसने दीदी बोलना शुरू किया है। स्टार्टिंग में
It's
उसकी एल्डर
developing.
सिस्टर को हमने नहीं बताया, वो गिगी ही अपने आप बोलना शुरू किया। ऐसे कहते थे शी इज दीदी, शी इज दीदी। नाउ शी इज सेइंग इन दिस ईयर दीदी, क्लियर दीदी
They
वर्ड
need that
क्लियर।
much of time to understand that the tongue is
How it
placing
is,
placed
yeah.
here for Didi, and Gigi is being the tongue has to be the tongue has to go back for it. It will definitely take time for them to understand all these things. I for my thing is like I won't like totally focus. First, I will see the language age of the child. The child's language age is good enough to do all that need. Only I will just go for the speech sound disorders and all. First, I'll really focus on the language only. The child language is okay, I'll just go to okay, I'll just correct the speech sound. In meanwhile, if the child is understanding all that and all, I'll just correct small sounds and all. First, the initial sounds I'll just try to connection like pa, ba, ma. These are all the simple sounds we can easily teach for the child, so that the child can easily see our mouth. We can easily tell. Then a little bit of tongue sounds like la, da, ta. These kinds of lingual sounds we'll say this one. These will emerge, and then the palatal sounds like ka, ga, ga. These and all will emerge later only. R and all, it will take longer time to emerge. R sounds and all.
क्या करना पड़ेगा मैम? स्पीच थेरेपी में जाए कि घर पे ये भी प्रैक्टिस कराएं?
वही, how they should support. They should seek for a speech therapist, or at home they can practice something. This is what ma'am said, na Kamna? Yogeshwari,
2.7-year-old, that child only, no? So you have already seen the speech therapist?
आपने देखा है कामना स्पीच थेरेपिस्ट से मिले हो?
नहीं मैम, अभी नहीं मिले हैं।
अभी नहीं मिले।
They have to see the speech therapist first.
एक असेसमेंट तो कराना।
इधर है नहीं थेरेपिस्ट।
आप कहाँ हो कामना?
मैम हम यूपी में क्या कहते हैं, उत्तर प्रदेश में बस्ती मतलब टाउन है, वहां पे है मैम।
हाँ. So I think we do have some specialists with us, Brinda, who give online
Manisha, I
consultation.
think ask her to speak to Manisha.
Yes,
Ma'am,
Manisha
आप
is here.
मनीषा से बात कर लो. Manisha, I think is here.
Manisha,
She's from Lucknow.
yeah.
तो
Manisha Agarwal.
मनीषा है
Yes,
शायद.
she is joined. Yes.
हाँ.
Yeah.
तो अगर मनीषा है तो शी कैन डेफिनेटली गाइड यू कि कोई है स्पीच थेरेपिस्ट जो ऑनलाइन थेरेपी ले वहां से, मतलब यूपी का ही कोई अगर ऑनलाइन
हाँ.
थेरेपी ले सके तो इट विल बिकम इजियर फॉर यू.
You,
तो
yes.
एक काम करती हूँ कामना मैम, मैं आपको मनीषा का नंबर
हाँ, you DM to her. Yes.
ठीक है.
हाँ, Kamna, you note down, and I think a person from UP will be able in a better position to help you, right?
करेक्ट. या
Yeah. So we the questions are coming so fast in the chat box now, and I'm so afraid that we have already short the time. And it says, I don't know how many. Awaz app, I think you have to find from the app site only that how it works. For the persons of Down syndrome, we are using this app. I'm not sure right now, right, Brenda?
We can use actually Avaz. We can use
Yes,
it.
ma'am. Then share something
It's a
about
paid
Awaz app.
app.
Yes, please do share something.
It's a paid app. We need to like see the speech therapist. Actually, they will teach. They will properly guide you to how to use the Avaz. There are some signs in that, and so that how the child can use it effectively to communicate. It's you can
Yeah.
just seek a speech therapist to
Yeah.
use that.
So it is what kind of an app? Like it converts your input to the sound and the device
We have a
speaks, or
gestures actually. We have a gestures like for the toilet, for the food gen and all that. We can actually edit the pictures in that also. We can just edit according to our
customize
like
for the
South
personal
Indian thing
use.
or North Indian thing. We can just customize all that things, so that we
Okay.
can make the child. It should has to be like customized according to the child also.
Yeah.
So
And
that
it's a paid app. If I have heard you
paid,
correct,
it's a
it's a
paid app.
paid app. Yes.
The
So
free version is available, but it's kind of a limited version. We can just use it for 3 months or something, so that we can just have a trial. After that, we need to pay.
we need to pay. Yes. I'm not sure. Parul, what do you suggest? We have a lot of questions coming up now. 5 for the. So my son is 16 years old, very reluctant to speak. How to introduce Awaz app?
He's
So
not even
again, you
using
have to
any
find.
words and all that.
Yeah. I don't know. This iPhone needs to speep. Parent with
It's
the need for
Havas is
iPhone.
kind of a like equipped communication system. You will just use the flashcards for now to communicate. It just use a lot of things and all like toilet of a picture, toilet of a food, toilet of a water. Sorry, the picture of a water, picture of everything. You can just take a picture in the normal situation. Just click a photo, just take a printout and just show him and just teach him this is the thing. If you want water, just point out the picture of a water. If you want to go for toilet, you just point out to the picture of the toilet. You just have to teach him in that way so that he can just like these
And
kinds of communications and all is very important for the child
yes,
to like basic communication is important for the child for doing
yeah.
all these things. You can just
You're
teach him.
sharing it for the 16-year-old particularly, right?
Yes, yes.
Yeah.
If the child
Because the
is
small
Excuse
children
me,
should be
ma'am.
encouraged to speak. Yes, who's this?
Excuse me, ma'am. That question is mine. The thing is,
Anji.
he can speak, but he
He doesn't want to
reluctant to
speak.
speak. Yeah,
Yeah.
he doesn't want to speak.
What is your
you
name,
want to
by the
open
way,
his
ma'am?
mouth itself.
I'm Lakmali from Sri Lanka.
Okay, okay. That's a parent from the Sri Lanka, ma'am. And he said he has speech, but he doesn't want his speech.
You need to
You,
see into
yeah, we
in
need
the
an
psychological
assessment.
background.
Yeah.
Psychological background is there. Why the child is not speaking, in what situation the child is not speaking, in what situation the child is speaking. So what
Yeah.
are the pleasant things the child is
Yeah.
having? So we need to assess all those things so that we
Yeah.
can really help the child.
Yes. Ma'am,
Okay.
also, ma'am has suggested that for Avaz app, you really need to see that speech pathologist around you
You want to use
who is
like
acquainted and trained in that.
yes. Actually, like if the child is like totally not communicating anything, means we can just go for the hours. If the child is having speech,
And not
but
using it.
only the child is not communicating in effective manner, means we need to see the psychologist first.
Yeah.
Yeah, if
So,
he want to eat or something, drink, he can ask properly.
So that he is communicating.
yeah.
Yeah,
He's
yeah.
not totally
So
non-verbal, right?
Yeah, it
Yeah.
can be associated with the other aspect ma'am is suggesting. So if required, do go to a psychologist and discuss. There may be other aspect of why he is not able, wanting to speak,
Wanting to speak.
you know,
Okay,
use
I
his
got it.
speech. Yeah, yeah. Thank you,
Okay,
ma'am.
thanks.
Okay. So, Parul, can we have any stoppage in coming questions pouring in? Ma'am, for me also the same problem that we don't have speech therapist here. Ma'am has already told about this, that she'll be sharing certain numbers and locations. Please put your location so that we can accordingly find out from Yogeshwari ma'am if any center or any person or any course mate of hers is nearby. Okay. So the another one is for 21 years age, what you'll say, can we improve speech? Is there any age limit for improvement in speech?
There is no particular limit to improve the speech, but the development will be like very slow after 7 years of age. So we need to like seek for any other alternate mode for communication. We need to seek in that thing. After that, all speech can come, but it will come in very slow manner. It will develop.
Yeah.
So we
But
need
what is recommended like in daily routine? I think it gets at this age it gets very impossible to give those cues and understand that you say then only it happens at 21 years of age. Do you want to recommend something or do you want
Yes,
to
yes,
share
yes,
something?
because
Something?
they should actually effectively communicate, right? Because they have to like solely, what if they want to live in an independent life and all that? They have to communicate themselves first. So we need to introduce some other modes of communication, if they are well equipped means we can use ours. If they want to use the low tech means we can use the pictures or picture exchange communication systems there. We can use all that things and all. So we need to like probe into the child. So what therapy thing will just fit to him? We just need to introduce it to him and we need to train him. That's
Yeah.
it.
Yeah. And we are already half an hour up. Huh? My daughter, formerly normal voice, now at the age of 25 years, child with Down syndrome, is talking in whispers. She covers her left ear regularly. Does it mean she likes less noise or talk on a low voice? Left ear continuously she covers. I think if you'll be able to.
That means she is closing her ear means she feels that normally if we close our ear means we feel our echo
Loud.
inside our head.
Okay.
We will feel that we are talking louder. So
Okay.
she's closing her ears and she feels that she's talking louder and she's whispering it out. She would have copied sometime. Whispering is would have been a little bit fascinated for her. She would have she would have tried all that and she's been carrying out all that. Just don't suddenly just don't try to avoid all those things. You just seek a therapist or something, therapist or somebody, so that you can really get help into it. Just try to give some any things or something into her hand while she's speaking. Definitely, you just give any things in her hand so that she can just don't close her ears, so that slowly she can just improve her voice. Whispering is it's not. We need to see whether she is totally whispering for everything or any other particular situations alone she is whispering, or we need to see all that.
And at the age of 25, suddenly it has happened. So earlier there was Sridhar Chandrasekhar. Are you there? I think that's the last question also of our session. Do you want to add or you are? I can't see. Brinda, are you able to locate this parent?
Yeah, thank you. Thank you so much. Thank you.
Yes, yes. Haan ji, haan ji. So, sir, would you like to add something more or did you understand something Yogeshwari ma'am shared?
No, I understood. No, basically, she was having a normal voice formerly, off late only in sense like from past 5 years. I think, like you rightly said, we should take one-on-one to some speech therapist, and her speech is clear. Only thing is the pitch and the decibel level is low. She talks in a low voice.
Okay, so
You just
maybe
see whether you just take some tests with the speech therapist whether she is something to do with anatomically say something is there, because some children will have the vocal nodules and all that will be there. You just see the speech therapist so that they can really guide you well.
Will this thing, I mean, is collection of wax in the ear a problem for the speech or not really?
It is the problem actually. Collection of wax is a problem, but it will drain out on its own. we need to go to ENT person
ENT.
to just clearly take out the wax properly. You need to. They'll be giving you the earwax solution, and
Yeah.
they'll be properly guiding you over there. You should
Yeah.
not putting any buds or any probes inside the ear to
Yes.
clear out the wax and all that.
Yeah. So
But
for
but
ENT, I
uh,
visited ENT for my daughter. So the wax, when it's wet, you put the drops, it comes out. When it is dried up and blocked or the clogged that air passage, then it becomes difficult. But if you so that the ENT will be able to guide you that how many days you have to use those drops, and it is a little painful when it has to unclog because the dried wax is like, and if it has to be removed, and they only will be removed under those good equipments where they can see and do not harm the internal ear.
earring.
Yeah. Yeah.
So if the earwax is too much, if it's clogged too much, if it's really hard, means definitely it will come over the role for the conduction here, there, over there. They'll be having some minimal hearing loss over there. So we need to seek help over there.
Thank you. Thank you so much.
Yeah. Thank you so much.
और
Thank
ये
God we are able to clarify. Yes, Parul.
This is our last question.
Yes.
Thank you, योगेश्वरी मैम, आपने बहुत पेशेंटली बहुत अच्छे से हमारे पेरेंट्स के सवालों के जवाब दिए हैं, और
थैंक यू
इसने भी जिस तरीके से एक्टिवली किया है इंटरेक्शन, और उसके बाद मुझे लगता है जिन जिन लोगों को किसी थेरेपिस्ट की ज़रूरत है, वो जैसा कि वृंदा जी ने बताया है कि उनसे बात कर लें मनीषा से, और वो वहाँ पे आपको
Yeah.
कर देंगी। मुझे लगता है समीक्षा, हमें वृंदा जी को रिक्वेस्ट करना चाहिए कि एक ऑनलाइन इस तरह का स्पीच के लिए एक प्लेटफॉर्म हमें तैयार करना चाहिए DSFI को, और बहुत हमारे पेरेंट्स की हेल्प हो जाएगी इस तरीके से।
Yes. Yes, and I also say that this one of the session DSFI already conducting that storytelling session. Brinda will agree because she is most of the time in the audience in that session. That articulation, modulation of your voice plays so much into your child's. Like I use it a lot. I use it for parents. I use it for the child, and that's how the self advocates connect to me. Because if I'm not able to listen, how to speak? So when it's like,
husband से
मुझे भी समझ नहीं आ रहा है so you have to get down to their level or go below one level. I think that animation, I mean, it comes naturally to me, so that's why I say talk to me. I will try to some people are not able to articulate themselves.
Yes,
Then it becomes a little difficult to understand. But that session, Brinda,
I know. Trust
you
me.
will see every child wanting to speak to Shivani
And
auntie,
they do, and they speak later. Yeah, they wait for it. We get
Yes.
questions. Dinesh, they don't have. I'm sure Parul also knows. Parul is always there with Charlie.
Yes. Yes.
Many of our parents go for that session, and trust me, it really helps. They try, and most of them try to interact with her. So I think that's what's important. Like each of us, I guess, tries to interact. Like Yogeshwari ma'am was saying, to understand, talk, listen first, which
Yeah.
Shivani does very well. So I guess
Yes.
that's why
Yes.
it works.
I think it is more to do with the parents' listening skills
Absolutely.
than child developing.
And it is true for
skills.
all of us, no, Sammy. I mean,
It is
forget
true.
our children. I
Yes.
mean, I'm sure all of you will agree. All
Yes,
of
and
us.
if Brinda is not able to understand what I'm trying to say, I get frustrated. Like, Brinda, what has happened? It is natural. It is natural. But because they are growing, and it should not hamper it in their ability to come back and talk to you again and feel disappointed. Like, ये तो समझता ही नहीं है, तो इससे बात ही क्या कर रही? So that preventing that, at least till 7 years, ma'am has mentioned that it has to be.
I mean, आपको बताऊं, ये जो बात है ना कि बच्चे फ्रस्ट्रेट होते हैं कि हमारी बात आप नहीं समझोगे, और ये दोनों सेंस में फिर वो बोलते हैं आप तो मुझे नहीं समझोगी, तो आप मेरी बोलने वाली बात भी नहीं समझोगी, और मैं जो यहाँ से बोलना चाह रही हूँ वो भी नहीं समझोगी। चांदनी आजकल हमेशा ये शिकायत करती है सबसे, तो मेरी बात नहीं समझोगी, फिर कभी अपने नहीं मुझे नहीं
मुझे बोलना ही। Yes.
आप कुछ बोलना चाहती हो सामी आंटी से? क्यों कुछ बोलना चाहती
क्यों?
Hi, Chandni. I know. Unnecessarily, only me and Parul can speak. No one else has time and patience for that. Thank you so much, Chandni. Thank you so much, Yogeshwari ma'am, for making it so convenient for parents to open up and speak and ask questions, and so patiently waiting for even we have डेढ़ आधा घंटा ज़्यादा ले लिया आपका. But thank you so much for taking out time, and we might call you again.
Yes, ma'am.
Yes, Shamini.
मैं ये बोल रही हूँ.
कह रही है तुम ही बोलती रहोगी, मुझे कुछ नहीं बोलने दोगी.
हाँ.
जल्दी बोलो, जल्दी. 1 मिनट है आपके पास. 1 सेकंड. जल्दी बोलो.
ठीक है, ठीक है.
मैं कुछ करती हूँ ना, मक्का का लगती हूँ, ये सब कुछ करती हूँ.
तुम बहुत काम करती हो.
We are so proud of you, Chandni, that आप मम्मा का ख्याल रखती हो. मम्मा को जरूरत है. Thank you, Yogeshwari ma'am. Thank you, Brinda. Thank you, Paru. Thank you,
Thanks,
parents.
Parul. Thanks, Sami, and thanks, Yogeshwari ma'am, for
Thank you,
being
thank
here
you.
at such short notice. See you all
Yes.
next week. And till then, bye-bye, everyone. Have a great Sunday.
Yeah, same
Thank
to
you.
you.
I'm ending
Bye,
the
bye.
meeting now.